everybody. I'm Sam Jones. Welcome to Perspectives. It's so good to have you here today. It's a bright, sunny day in this part of the state, but there are evil things lurking out there, and we have somebody here that's going to be able to address them for us. Our first guest is J.P. Williams with the Tulsa Health Department. J.P., welcome.
Thank you. Thank you so much. It's my pleasure to be here today.
Former student?
Former student, graduated of the nursing program in 1998.
Says a lot about the school.
Absolutely.
We have a problem. We have a problem with tuberculosis. How bad is it?
Well, I want the viewers not to be concerned about Tulsa County. We have 9 active cases, and that's fairly low compared.
That's in Tulsa County?
In Tulsa County, absolutely. Our neighboring state, Kansas, I mean, it's been in the news, but they have 67 active cases and considered to be in an outbreak. I know the health officials in that state are working really close and monitoring and trying to contain that with their state health department.
What are the symptoms?
A cough that is 2 weeks in persistence, weight loss, sweat, fatigue, blood-tinged sputum, all of those things warrant further investigation, and we want individuals to seek medical screening immediately.
You see, I thought that TB was a thing of the past. I thought, well, we don't have to worry about that guy anymore. There are other things out there to worry about.
Right.
I was wrong, wasn't I?
Well, it certainly appears to be the case.
Yeah.
What we want people to understand is that the spread of TB can be contained. People that are more vulnerable or that have compromised immune system, avoid large gatherings, make sure that you wear a protective mask and covering if you're out, and really to avoid large crowds if you have any type of a compromised immune system. But for the general public, most people are in what we consider a low risk. Mm-hmm. But people that are in unhoused or homeless shelters, correctional facilities, those type of places tend to have a higher risk or a moderate risk of TB.
I know we have you here to talk about TB, but can we talk about measles for just a minute?
Sure.
There's an outbreak in Texas.
Mm-hmm.
It's jumped from, I think, 90 cases to 129 cases,
mm-hmm.
virtually overnight.
Mm-hmm.
Measles is a different beast altogether. And as I understand it, correct me if I'm wrong, but the exposure to measles can hang in the air for up to 2 hours. You can walk through it and not even know.
Yes.
Is that coming this way?
I hope not. I hope not. But again, there is no travel. We travel. We're talking about Kansas and Texas. That's a rock throw away, and people often travel between those 2 states. Mm-hmm. We know that. So it certainly could come to Oklahoma. We want people to be aware of what's going on in our neighboring states, and that if symptoms of these diseases are present, they need to seek their healthcare providers immediately.
How many cases of TB would you guesstimate are fatal yearly? Well,
there are worldwide, there are millions of people that die of TB. We know that. Any case could be fatal if the proper treatment is not followed and people are not seeking those type of treatment options. We want people to, come to the Tulsa Health Department if they have any of the symptoms that I mentioned. We have a very great monitoring program, treatment program that we can follow those individuals to make sure that they're compliant with their treatment and that they have access to that, irregardless to the inability to pay or not. So we have those services and treatment options available.
Is it an extensive treatment program?
It is, and I want to say that sometimes that is what we are up against, because we're talking about a 9-month treatment regimen, and to follow individuals to make sure that they're compliant with that is the key. And we need to make sure that people understand that we want you to seek treatment, but to follow those treatment specifically as directed by your physician.
It strikes me that because we have such a large homeless population, that there are dangers lurking there as well.
Certainly. I mean, we know that, the World Health Organization, the CDC, even our practitioners, we know that those at-risk populations have a greater risk. What's important is that if individuals present with any of those symptoms, that they seek screening immediately so treatment can be started. That is the key.
Otherwise, it's going to spread like wildfire.
It will certainly spread. It has the potential to do so.
When did your eyebrows first go up over what's going on in our neighboring state?
Well, actually, it started a year ago.
Did it?
Yes, it started a year ago, and it has been being monitored because there's more cases this year than it was. They're at 69. They had over 78 or so for the whole year. So that tells you that, we still have some work to do with our neighboring state, Kansas. Well, they have work to do. But it actually, the outbreak, the attention was noticed January of last year.
I promised you, and I'm going to keep that promise, that I would not drag you into a political discourse. However, having said that, it concerns me we're seeing so many people at the National Institutes of Health, the World Health Organization, that's the one that's housed in this country, and other health organizations being stripped of funding and people being fired. That has to concern you.
Well, anytime there's budget reductions in preventing us to do the work that we need to do in preventive health, it is concerning. But what gives me hope is that we are still able to provide some services, and we need to be very vigilant on making sure that we provide awareness to the public and we provide access to the treatment that we can do right now today.
Well, with all due respect to the popcorn industry, would folks be wise to wear a mask when they go to a movie?
Again, I always recommend a mask. If you are going to go into large bodies of populated areas, wearing a mask can only provide a level of protection. And individuals make those choices to do so, but you can never go wrong with putting any line of protection, whether that's avoiding large crowds or wearing a mask.
About 20 seconds left.
Okay.
At what point will the health department start to issue warnings about what's going on across the border with TB?
Well, we're transparent with our numbers, our active cases, that is a public knowledge. We monitor those daily, multiple times through the day. We have a TB clinic that provides education. We do consultation to providers, schools, churches, organizations, if they need guidance on how to protect the people that enter those places. So we're readily available to help the community with any questions or concerns they have about TB.
JP, we're out of time.
Okay.
With all due respect, if this starts to grow and grow rapidly, will you come back?
Absolutely. I would love to come back.
We'd love to have you back. Thank you.
This is home. I'd love to come back.
All right, I love it. We're going to take a short break. We'll be back with more right after this.